I wanted to just do some quick introductions for those of you that are just joining us or maybe joined us in midway through. I'll give you a reminder. The portion of the webinar platform where you can use to ask questions is there, and it's called Questions. Please use that platform and not the chat feature, because I won't be able to capture any of your questions and then answer them if we can't get to them all in the time allotted. So just a quick housekeeping note there. And I will now introduce our next speakers. So I'm going to start with you. Blake Cohen is a certified addictions professional and a best-selling author of I Love You More, Short Stories of Addiction, Recovery and Loss from a Family's Perspective. He also is offering a wellness presentation to corporate environments that discuss the silent illness that is affecting millions in the workplace, addiction. This is an interactive and educational presentation that he discusses the opioid epidemic, addiction, and addiction in the workplace, and also the stigma surrounding it. So Blake has a great background in professional speaking. He's a best-selling author, and he's with Recovery Unplugged, who is one of our concierge clients and just one of the best recovery centers we've really ever seen in our time of working with recovery centers that work with employers. So thank you, Blake, for joining. And I also want to welcome Tori. Tori Davis is a human resource professional with experience in higher education, a K-12 school district, as well as nuclear energy field. In addition, he's the board chair / president of Public Health Innovations in Research and Development, the Columbia, South Carolina branch. And he seeks to bring health solutions in the area of disease management to the community. Also, he is a doctoral student at Grand Canyon University within the psychology degree track with an emphasis in industrial organizational psychology, studying employer wellness and well-being programs. So thank you both for joining me today. I'd like to jump right into our fireside chat if I could. And it's been such great presentation so far, so I can't wait to jump into this discussion where we'll really be breaking down some of the stigmas around addiction in the workplace, as well as what can you do if you know that somebody's suffering. And so I'd like to start with you, Blake, if I could.
Sure.
In your experience, how do you help employers with even thinking about addressing the stigma around addiction in the workplace?
Well, yeah, first of all, thank you for having me, and I appreciate it. And it's scary how much that cartoon looks like me down there, by the way. So the way that we get them to start thinking about it is it just starts off with discussing it. I mean, and it's the most basic principle there is. Let's just talk about it. It's not something that has to be taboo or has to be afraid to talk about. Let's educate people on it. Let's educate the employees on it. Let's educate the HR departments on it. Let's educate all of the employees in the corporation about the disease of addiction and how it affects everybody, not just certain populations like people thought. And let's face the stigma head on. I mean, the stigma surrounding addiction is a very outdated stigma that stems from that old war on drugs that they try to wrest their way out of and victimize people who struggle with this disease by throwing them in jail. There's no reason to avoid talking about it. And I think it's important to recognize that 75% of people struggling with a substance use disorder are employed. So most of these people are in your workplace, and they're too afraid to ask for help. So for me, one thing I will say is that everyone's first reaction when I say that I want to talk about addiction and come to your workplace and do a fireside chat there and educate people about the disease of addiction, everyone's first reaction is, oh, I don't know how people are going to respond to that one. And yet I've seen every time I've gone to speak at any of there's been about 10 different corporate events I've done now, it's always the biggest turnout. It's always the biggest turnout, and everybody wants to talk about this, and everybody is yearning to discuss it and learn about it. It's just, it's not being offered, and they're too afraid to ask for it.
Does that answer your question? Great answer. Okay. That definitely does. And Tori, when you're, in the HR role, what are some of the difficulties, even starting the conversation with employees in that role, and kind of how do you kind of work to overcome those?
Excuse me. As Blake said, and thank you for having me as well, Jenny. But as Blake said, just starting with HR programs and wellness programs, as also Pete spoke about, and having them be well-rounded and the need to be transparent. So just starting that conversation to begin with and not being scared to do so is pretty much where you need to start. And HR has the ability to provide employee assistance programs to their population, which provides resources for addiction and managing any type of chronic diseases. So that's very key to promote, so your employees understand the benefits that are at their fingertips, because that promoting employee assistance programs can change the perceptions and feelings about how an employee feels about their mental state, and the organization may be seen as Big Brother is watching them. So that's a common theme that I've seen within organizations. So highlighting what the employee assistance programs can bring to the environment can foster a safe zone for employees to safely identify if they do have an addiction problem. And then when they do identify that they have an addiction or a chronic disease of some sort, providing them the help. As Blake stated, we don't want to just throw somebody in jail. Give them the resources that they can become successful and overcome their addictions. In addition, with wellness programs, bringing speakers to the work location that talks about specific target areas for the organization can create a trusting environment, because sometimes the employees don't want to talk to HR. But if you're bringing in local professionals that actually deal and handle with addiction, they're more apt to speak to them. So bringing in those local people that work with addiction, that work with chronic illnesses and diseases, is also key to starting that conversation with the employees.
That's an excellent point, honestly. And I think, Pete mentioned it as well earlier, and so did Michael. It's helping people understand that stigma and shame really should not be, one and the same. And understanding the Big Brother factor that you mentioned, and how that can affect your ability to want to come forward with an issue, also makes it very interesting. And Michael Weiner with Ernst & Young spoke about how their data also suggested that fewer people came forward wanting to talk about addiction. And instead of saying, well, that's because no one's addicted, what I found interesting with that employer was, instead of saying, well, they didn't come forward because that's not a problem for them, he said, let's predict why they didn't come forward. And then let's go ahead and bring in, as you mentioned, Blake and Tori, speakers that can actually address this problem head on and begin the conversation. So forward thinking, we're not talking about it now, people aren't ready for it, but it's interesting that he realizes that that's due to this shame or stigma, and so he's willing to take the extra step to bring more people in to talk about it. So I thought that was really interesting. Another question that came to us, Tori, and I'll start with you on this one, is why is mental health awareness a necessary issue to tackle, and to create better solutions for addiction in the workplace?
Mental health, chronic diseases are definitely necessary to tackle within the workforce. Just simply for one reason, safety and security. Safety is a huge concern. If someone is struggling with mental health, they could engage in unsafe behavior and violent outbursts, not only to themselves, but to other people as well. So just from a safety and security standpoint, we need to address mental health in the workplace. Also, mental health also stems from family struggles, financial concerns, work-life balance. And so employers providing the resources to help employees plan for the future, retirement programs, wellness programs, health programs, and offer education to, let's just say, the sandwich generation, because that's kind of huge right now. The sandwich generation is a population of people where they're taking care of their elderly parents, but they're also taking care of their children or sending their children to college while trying to work, while trying to have work-life balance, and that takes a toll on somebody's mental and emotional stability. So if an organization can provide resources, let's say for elderly care, not necessarily sponsoring those resources, but providing them with the resources that are in the community where they can go and talk to those folks and really see how they can have people help take care of their parents. If you bring in 529 plans or education about 529 plans and preparing for college, that also helps mitigate the stressors that someone in the sandwich generation may feel. But also, just from a business perspective, addressing mental health also helps with productivity, absenteeism, and presenteeism. So if someone's healthy at work and they're focused, then they're going to be doing their job to their maximum capability. They're not going to be trying to miss work for doctor's appointments, and they're going to be fully present. So if we're addressing these issues at work and providing the employees with resources to be successful, then that of course affects an organization's bottom line. Lastly, how does an organization actually know what type of educational seminars to offer their population? Really, you can start with examining health claims, disability claims, anything of that nature, which can tell you where chronic diseases or addiction lies, and then taking those top 3 or 4 concerns and tackling those head on by providing the employees with the resources that they need, and then measuring those programs through something of a correlation test, because it's not a cause and effect, but you want to see when I implemented X program, let's just say for addiction, did we see a reduction in our disability cases that are resulting in addictive behaviors and going to rehab? So I think that's very key for addressing mental health and chronic diseases in the workforce. It's just, ensuring that we're offering those educational seminars and that organizations are ensuring that they're taking care of their population just from a mental health standpoint.
That's great. And Blake, when you provide education and training for organizations on mental health, what is your main focus at Recovery Unplugged and just in your professional experience?
I think there's multiple answers to that, and I have a couple main focuses. I think the bigger one, of course, is to educate people on the disease of addiction and help them to further understand it, and not just understand it, but to normalize it a little bit. And help them recognize that it can happen to anybody. It's not, like I said before, it's not just a specific population that addiction affects. It can affect anybody. And my goal is to show people that people who struggle with substance use disorders aren't bad people. Some of the behaviors that surround it or that are a result of their addictive behaviors may not be morally acceptable, but a lot of that is because their brain has been hijacked and their neurotransmitters aren't firing correctly. And I want to explain that to people to help them further understand it. But my ancillary goal when I go into these events and I go to a different corporation is to help to foster a workplace environment that is more open, that is more accepting, that is more loving. And, I'm hoping that they recognize that people are spending most of their time at work. And so if the workplace and the employers are caring about their employees' mental health and their employees' happiness, they are going to benefit. So the better the workplace environment, the more productivity they're going to have, the more creativity they're going to have, the more people will be opening up and trying new things, and the more they're going to advance as a company. Instead of just brushing certain issues under the rug, I want them to face them head on.
I think that is such a good perspective, Blake, and just understanding that, employers, there is this whole thing about work-life balance, and one of our other panelists from a previous event kind of explained it as not linear in nature, but circular in nature, where work and life kind of comes together in a circle, and she explained how she thought of her work and her life as a pie. And I think it's so true that you're not talking about this balance between work and life anymore. Life and work are kind of synonymous with one another, as is, everything that we do. And so to think, how do I balance this time if I have, say, a challenge with an addiction? It's it can be daunting and also impossible. And so for
Hmm.
employers to understand that, because this isn't something that an illness that can be turned off so that there's balance at work and then at home they can be sick, but at work they can just turn it off. I think it helps to realize, this is a biological, physiological, it's a chronic disease. And so when somebody's facing or struggling with this, providing the resources like education that you're providing and all the different steps that you can take to learn more about health, I think is vastly important. And, the cost of replacing employees is so much higher than
Oh
helping
yeah.
them get better.
Helping them get better. Yeah, and there's this, again, I keep going back to these, it's kind of like this archaic way of thinking of like you keep your personal life at home, and when you're at work, I just want you to focus on your job. Well, that's really hard to do, and there's certain issues that you surpass the ability to be able to hide it and keep it at home. If you had a fight with your husband or your wife, and then that's something maybe you can keep it at home. But if you're dealing with an addiction problem where you're by 2 p.m. you're starting to have cravings and you're starting to go through withdrawals and you can't focus, that means you've checked out of work at 2 p.m. instead of 5 p.m. or 6 p.m. or 7, whenever you're supposed to. That you've checked out, and all you can think about in your head is, when am I going to go get that next fix? How am I going to start feeling better? So it's impossible to keep that work-life balance when you're struggling with mental health disorders, when you're struggling with addiction. It's really hard, because when those things hit you, you can't focus. And just to touch on what you were saying, the question you asked me again, just a little bit more of, part of what I talk about when I go to these corporations, and Tori, you touched on this. I don't know that employers, and it may just be a lack of time or whatever it may be, but they're not letting the employees know really all of the resources that are at their fingertips, besides just giving them a pamphlet saying, hey, by the way, if you struggle with any issues, you have an EAP that can help you. They don't let them know that there are such things like FMLA, where somebody can take a medical leave, be under a doctor's care, and keep their job, legally keep their job. They're not aware that their insurance actually can cover a lot of the treatments that they need to go get. They're not aware of HIPAA laws and what those HIPAA laws really mean, and that they apply to behavioral health as well, that someone can go get treatment and not everyone's going to know about it. Just whoever they sign a release for is going to know about it. So, and they also don't know exactly what their EAP does for them. And I was glad to listen a little bit earlier, and I don't remember who said it, but someone was talking about how EAP usage is up in their companies. And it's really refreshing, and I'm really happy to hear that, because I've known recent statistics that I've seen were saying that only 3% of employees actually use their EAP. And I would suspect that's because they don't know what their EAP does, and they don't know how the EAP can help, and they don't know that they're safe with that EAP.
Oh,
Blake,
fully. And I
totally.
have to say, Blake, and I'll let you go, Tori. One of the major concerns that I had when we were putting this whole thing together was the fact that there was not engagement from the EAP side. So I did have great employers that wanted to participate and talk to me, but when I was reaching out for speakers on the EAP side, I had a real struggle getting them involved.
Mhm.
And I think that's why we're going to do this last conversation with LifeWorks, because it's so important for the EAP to be a partner and help you. It's not just a resource that's there if you needed, a commodity that they can go and use if they want. It's something so much more important. And Tori, go ahead. Sorry about that.
Oh, you're fine. I was going to agree with Blake about how employees don't understand the benefits that are at their fingertips. Working in the FMLA realm, which I have before, people don't even understand what FMLA is and how that can benefit them in keeping their job. So focal points from an organizational perspective would be educating your population, making them aware of the benefits and resources at their fingertips, and then also driving those resources home. Family members also need to know about those resources, because sometimes what I found is that employees are reluctant to utilize those resources. So having that encouragement from their family members to utilize the benefits that they have, that's in their health plan, that FMLA programs that are out there, the EAP programs that are out there, free counseling sometimes through EAP programs for 3 to 4 sessions. That can help get them jump started and going in the right direction. And going back to that work-life balance, if your home life is out of kilter, that will show up in the workplace as well, and that will affect, how an employee performs and if they're present or if they have to miss work. So there is that circular effect that, your home life does affect your work life, and vice versa, your work life also affects your home life. And so that's a big component of mental health. So programs like a telehealth or telecounseling, if employees don't feel like they can leave work to go to counseling, or they have a stigma of walking into a counseling facility, those are programs that are out there that they can utilize their tablets, their computers, their phones, and speak to counselors right there from the comfort of their living room. So making sure employees are aware of those type of programs if they're in your benefits package is also key to kind of heading off the mental health and addiction stigmas that are out there. And there are behavioral health programs that are also done electronically now, that someone doesn't have to go into a facility to receive counseling. They can do it from the comfort of their home, and it's also less expensive from an employer standpoint. So it's a win-win for the employer and the employee if the employers are advertising these benefits to their population that they can utilize.
There's behavioral options for telehealth, and there's also medical options for telehealth as well, which I know for, I'm just going to try to speak within the realm that I work in, but with addiction medicine, there's a lot of like Vivitrol or Suboxone, Methadone, naltrexone, a lot of the substances, a lot of the medications that people take for medication-assisted therapies. It can be really hard to find a psychiatrist or a doctor's office in your area, but you can use telehealth to fill those prescriptions. The other thing that I wanted to mention about EAPs, and it's more about the employer letting the employees know what is offered and what the EAP does, but also they need to do better. And this is my belief, and I'm starting to see them do this, but to do better at explaining why it's important to use your EAP instead of just going on Google. If you're struggling with something, you need to go speak to your EAP, because your EAP probably has vetted programs, vetted therapists, vetted doctor's office, places that they're going to refer you to that are chosen because they're good programs. Instead of, there's a huge danger, and everybody knows about the South Florida treatment, and now it's all out in California, where there's all this egregious behavior and patient brokering and all of these things going on. It's been all over the news, and it's very dangerous. And a lot of it's because people just go on Google and type in drug addiction treatment, and they click on the first one, and they get sucked into some crazy call center that's going to abuse their insurance benefit and not really get them better. So it's important that EAPs and employers, talk about why it's important to use the EAP. And a little side thing is, I think it's important that EAPs do a better job of vetting out programs and not just saying, hey, call your insurance. This place, call your insurance. They'll tell you what they cover, because a lot of times even those programs, just because they're in network with your insurance, doesn't mean they're good.
Like we're doing a lot of this right now as an organization, and working with organizations like yours and others to help EAPs kind of vet programs. And so I'm glad that you mentioned that, because I definitely think somebody has to take responsibility for sure in helping to recommend what are the options out there and what is the best option for your employee. And should it be a telehealth solution that is done from home, as Tori was suggesting, initially, and then kind of determine from there, do we need a inpatient type care where we might need to utilize FMLA, and how can we shift that decision and make those decisions? And we can't if we don't have a good partner that's helping us make determination of what's available and what they should go to. And again, finding it on Google, as you said, it's really a crapshoot.
It's dangerous.
Yeah, agreed. Sorry, Tori, go ahead.
No, I was just agreeing with Blake. When I worked in the FMLA field, one of the first conversations that I would have, whether the employee was taking FMLA for themselves or another family member is the EAP benefit. It's there for the employee to utilize. So every single conversation, it either started or ended with discussing EAP, and that you have a free consultation, and then they can help you find resources for whatever your circumstances are. And the reaction from the employees were, well, I didn't know that we had that. So it's just very key that, as an employer, we make sure that we let our employees know about the benefits that are within their fingertips, and telehealth is within your health programs or within your health insurance. And counseling is covered through health insurance as well. So just letting employees know what benefits they have when they come and actually talk to human resources. That's very key.
And not just once. Not just
Right.
once in the onboarding process. That's what I keep seeing is in the onboarding process, they tell you what's at your fingertips and they never bring it up again. So
Yes.
having these monthly discussions, having someone like myself or Tori or Pete Thomas, anybody come out to your company and discuss mental health, and then have an HR representative or an EAP representative there to remind everybody, hey, by the way, if you come talk to us, X, Y, and Z are available to you.
What it makes me think of too, something you and I and Tori talked about, and maybe Tori, you can address it first, is what about Big Brother? What does that have to do with this? And sometimes I think employees also, they hear these great things, we do this great education, and there's still that fear factor. So, what does Big Brother have to do with it? I guess I'd say.
Big Brother, that's a term that I've utilized in my stint through human resources. And basically it comes from the actual reality show, Big Brother, where there were just cameras everywhere and we could see every move they ever made. Well, employees actually feel like the organization operates as Big Brother. So we have to help them overcome that stigma, as Blake mentioned earlier, HIPAA requirement. We don't even know from an employer standpoint who had what claim. There's no social security tied to it, no social security number, no name, no employee ID. We get data in aggregate. And through a lot of research, I actually found that 1/3 of the population of an employer within the United States generally does not have or feel they have a trusting relationship with their employer. And that's generally due to the lack of understanding of that their data is not being passed to us with their name on it. However, 2/3, 66% of employees within organizations within the United States feel the actual employer has a responsibility in offering a healthy lifestyle for them. So, when you kind of look at that then bet the question of how does an employer not become Big Brother, but yet satisfy the needs of assisting and creating a healthier lifestyle for their employees. And that goes back to a lot of the attributes we've already spoken of earlier, is being transparent and promoting programs that are within the benefits package. Also helping employees understand that their data is provided to the organization in aggregate. So one thing that I do when I speak at organizations is I really focus on that point, and you can kind of see light bulbs going off like, oh, they're really not getting my data. We're only getting the collective data of everyone who's participating in whatever benefit that the organization offers. And we just go from there with running analysis on what programs do we need to target, how many people are we having chronic illnesses or addictions with. We need to start bringing more programs in for that. But we actually never know who. And so just bringing down that stigma of Big Brother actually helps employees come forward and actually partake in the benefits that are offered and actually receive the resources that are needed. And then also ensuring that there's no retaliation. Employees sometimes feel if I come forward that I have an addiction, well, the employer is going to fire me or I'm going to get thrown in jail. So creating that safe environment that we spoke of earlier to ensure that employees can self-identify and then receive the help they need, that also reduces the stigma of Big Brother.
That's great. That's great. Thank you very much for, that theory and your thoughts on that, because I agree it can be a tough thing to overcome. But I think the general theme of what we're talking about is educating, right? I mean,
Yeah, it's as simple as that. In my opinion, that's how we slow this opioid epidemic down, this addiction epidemic, suicide epidemic. Everything that we're going through is just purely through educating and not being afraid to talk about it. And I think within the corporate world, it's about the leaders getting behind it. And I think they talked about that a little bit before with the other panelists, that the leaders are the one who need to be transparent first, and they need to be the ones, so because everything's trickled down in most companies. So if the leaders start talking about issues, and they're the ones expressing that it's okay to discuss, I think their employees are more likely to talk about it as well. So the leaders need to set the tone for the rest of the employees.
right. And I think they're starting to see the benefits of this. Again, if you're looking at work-life balance, and I don't know, that's not a term that I think is good, and you think of life as a circle, work being a big portion of what you do during your life, and then, outside of work, your family and other hobbies and, whatever else your balance is outside of work, you know, could be considered the responsibility of the employer to really care for those folks as they are caring for the organization. And so there's that synergistic relationship between employee and employer when the investment of care for the employee becomes a reality. There's this back and forth give and take between the employee and the employer, and there's less of a big brother fear or those types of things because they see it as a synergy. Another question, and this one's for you, Blake. From your personal journey, what advice would you give someone who is either suffering in silence with addiction or has a family member suffering?
Yeah, so you mentioned my personal journey, so that and I don't, of course, don't mind divulging this, and it's part of my book, and I'm pretty public about this, that I am in recovery from a substance use disorder, in fact, multiple substances, and since 2012, so New Year's Eve 2012. So it is possible, by the way, to get sober on New Year's Eve. It does happen. It wasn't by choice, but it can happen. My advice to people who are struggling or who have a loved one that are struggling is to go get that professional help and to stop letting it go on any longer. Again, we'll bringing it back to corporations. What I see people do is that they keep it hidden too long, just a little bit too long, to the point where they lose their job or they get in trouble at work and something bad happens, or they get arrested or their loved one leaves them. People always wait until this major consequence happens in their life as a motivator before they get help. And people do that because they're embarrassed, and so they want to push it off. I know for me, I pushed off my recovery because I didn't want to admit that I had relapsed. I was in recovery for a little while and I ended up relapsing. So in my head, from the day that relapse started, I knew that I needed to get back and to admit that I had an issue and go back to a 12-step program and do what I needed to do for my recovery. But I was just way too embarrassed to admit that I had a slip up. So I had to wait for it to get really bad for me to lose my apartment and almost lose my girlfriend, who's now my wife. I, lost my family for a long time. And it didn't have to get that bad. If I wasn't so ashamed, it wouldn't have had to get that bad. So what I suggest ultimately is to be brave. And I'm asking for bravery from anybody who's struggling, anybody who has a loved one who's struggling, is to face it head on, treat it like any other illness, and admit defeat. And with that admit comes strength.
That's great. Thank you so much for being willing to share your story, because I know people that are listening have family members that are going through something, or themselves may be going through something. And sure. It definitely takes bravery to make a difference. And I love that you said, don't wait until a catastrophic event occurs before you try to get some help due to embarrassment or shame.
Yeah.
Because, it's not necessary once you finally take a 12-step program, get into a recovery center like Recovery on Plus, do the steps that you need to take to get help. you didn't need to hit the worst place in your life to get there. Once you start on this journey, you'll see a whole new life that, that you may struggle with in the future. It is a long life-term, balancing journey. If I have type 2 diabetes and I lose all this weight and I exercise and I address all my mental health issues and I do great, and then I lapse and I just say, oh, well, I'm just going to eat donuts and salt, and then I might get type 2 diabetes again. I could, go right back to that chronic disease. So it is a management thing. Thanks for sharing that, Blake. I really
No,
appreciate it.
it's my pleasure. And I think, I hope that I can be a beacon of hope to show people who are struggling that it's possible. And I hope I can show families, not to bring it back to my book, but it's just, there's something really powerful in the end where the whole book is about the family systems and how families struggle with it and offering perspective. And I actually asked my dad to write a chapter for me. So the last chapter in the book is from my dad's perspective. And he gives some really powerful advice because, first of all, he says that he gave up on me and that he thought it was hopeless, that he had lost me forever, but now realizes that he can be proud of me and be proud of who I am. And he's happy to have me back. But he gives some really powerful advice that do not coddle, do not enable, do something. You have to face it head on, and you can't avoid it. You can't pretend like it's not there. You need to face it head on, because again, the reality of what we're dealing with right now is we're not dealing with grandma and grandpa's drugs anymore, or grandma and grandpa's alcohol anymore, or type of addictions or mental health anymore. People are dying left and right. I mean, we're talking hundreds of thousands of people dying from substance use disorders every year. Suicide, the numbers are astronomical. So we're dealing with life and death now. So you can either face it now, or you can wait and you can hit that ultimate bottom that you never come back from.
Dr. Dan Dowd was giving us some statistics earlier on that, suicide specifically. And in the statistics, he read that 850 suicides are now happening every single week. So that is every week, 850 people are killing themselves. And,
wow. That's crazy.
And are dying by suicide. It's just you're right, the time is definitely imperative for addressing any kind of addiction, stigma, mental health. It's definitely time to talk about it. So,
yeah.
And I think sharing stories like this helps us so much. So thank you for that, Blake. Hey, Corey, can you talk about your initiative in overcoming the opioid crisis and what you've done, in your work with the prizes you've won and things like that?
With the opioid crisis, again, having a well-rounded wellness program that has an EAP representative that comes out, speaks about stress management, speaks about addiction, have professionals come out that speak about addiction, and then providing those resources to the population so that employee can feel comfortable going to them if they don't feel comfortable going to the organization, has been key in taking steps to hopefully overcoming this opioid crisis. Also, within the health insurance STEP programs, what that is not letting surgery be the first option. Because when someone has surgery and they're in recovery, generally they're put on some type of opioid. And from there, things can quickly go downhill. So having STEP programs that may have therapy sessions built in, or like physical therapy that's done electronically. So an employee doesn't have to miss work, or they can do it in the comfort of their home. Just having those checkpoints within your program that do not allow an employee to go directly to surgery can also minimize the effects of opioid. And then, of course, everything we've been stating thus far, as far as promoting the EAP benefits, ensuring transparency of the benefits offered, such as FMLA, disability, how they work in conjunction with EAP, examining disability claims to kind of determine what type of addictions are in your organization if someone does go out for an addiction claim, can also help combat any type of opioid usage as well, because sometimes that can be a gateway to other types of drugs that are out there, other hardcore drugs. So it's very key to understanding that. Also, your pharmacy management benefits, not allowing your participants within your health plan to go from pharmacy to pharmacy to pharmacy getting these opioid drugs. So if they get it at one pharmacy, it registers with your pharmacy management program and your insurance company, so they're not able to go in the next 15 days and get another prescription of some sort. So just having those programs in place put stop gaps for the employee and their accessibility to actually picking up opioids. And then again, lastly, creating that environment within the workforce that is safe for people to self-identify. I can't stress that enough. Self-identification and ridding that big brother stigma really helps employees come forward, and then that really helps them be able to take advantage of the benefits that they have. Again, as Blake mentioned earlier, we don't want to throw anyone in jail or make them feel like they can't come to us, and now they're spiraling further and further into a pit that they may not be able to get out of. We want to ensure that they feel comfortable coming to identify, and then as an employers, okay, well, how can we help? And then getting their family involved. How can they help? Helping their family understand the benefits. So as Blake, you said your book, dealing with the family unit, that's very key to helping manage the opioid crisis or any chronic addiction that an employee or a family member may have.
Blake, final words for our group?
I guess I would just say, thank you for having me. And I'm blessed to work for a program and for a company that I still remember the day that I went and they hired me. So one of the owners, Paul Pellinger, who just designed our whole Music is Our Medicine program and how we use music in conjunction with clinical modalities to treat people struggling with addiction and to speak to their soul and not just their head. He said to me when I first started that he was happier for me than he is for him. And he said, I'm not saying that in a egotistical way. You'll understand what I mean in a few months. And he was so right, because it's such a loving and open environment where I am the happiest I've ever been working for Recovery Unplugged. And they're an example of what a company should be like, constantly letting us know that there's help if anything's wrong, constantly asking, are you okay? Is everything going okay with you? Let's talk about this, let's talk about that, congratulating each other for each other's successes. It's just a very supportive and loving environment. And I feel like I am at home even when I'm at work. So I urge other companies to start fostering an environment similar to Recovery Unplugged. I mean, it's the perfect environment for somebody to get sober, because the opposite of addiction is connection. We've all heard that before now. It's the perfect environment for somebody to come to for that type of treatment, but it's also a great model that other companies should start to follow. I'm happy to talk to anybody about it.
I love it. I think, I personally saw that in touring the facility, but more importantly, Recovery Unplugged is an employer, and you have benefits and you have programs. And what I saw was not just a culture of care for the patients, but a culture of care for the employees. And I think, that you just said it so well. It's treating people the way you'd want to be treated, cultivating a happy environment. And when you give, you get. It's just all like a natural thing. And so the fact that they're, giving to you and giving you these, tools and being available and truly caring makes it that much, sweeter to be where you are in the workplace. So that's fantastic.
Yeah.
And I'm so blessed also to get to work with all of you. And, I've seen your facilities, and anyone who is struggling or knows someone who's struggling, others I've seen as well. Yours is not a clinical facility. It is very cool. It's modern.
Well, it is clinical. The clinical's hidden in the very cool environment.
It's there.
And that's
but
what's
I didn't
that's
feel
what's
like
the
I was
best
at
part
the
about it.
hospital.
You don't feel like you're in a hospital.
Not at all. I felt like I was in a home. I felt like I was at my home. There were pictures of rock stars and music everywhere, throughout the home and throughout the facility, which felt like my home, and I think that to me was really important. I thought, that's what this kind of retreat or this kind of recovery place that you can get away and really feel like you're in a safe but very at-home environment. So kudos to you guys. It's a great program. And Tori, for you, any last words before we go to our next presentation?
I just want to thank you for the opportunity to speak. And as you know, I'm very passionate about wellness and chronic disease, and from an employer standpoint. And I just look forward to keep working in this field and providing benefits to employees that can enhance their life, reduce their chances of encountering any type of opioids, and if they do have any chronic diseases or illnesses, and just managing those. But also, just to the employers who are listening out there, just ensure that you are being transparent and that you are communicating through any communication channel that you have, all of the benefits and resources that you possibly can. And it helps to have a management sponsor, as Blake mentioned earlier, with leadership. So having your leadership promote some of the benefits that you have that can combat some of these chronic diseases and illnesses and opioid crisis is key to having your employee population be locked in and engaged.
Well, thank you both again so much. For those of you on the call that want to learn a little bit more about Recovery Unplugged, you can always reach out to me, and I'd be happy to introduce you to Blake. If you'd like to have Blake come to your facility, he was at Samsung. He went to Marsh's, like 5 employers. I just had somebody comment that Radhika Charles from Saposnik says, Blake is awesome. He came to their organization and brought his education and training, and it's just it's something that every employer that I've had experience Blake's event. And then also check out his book, I Love You More. It's so good. You can get it on his website. And Blake, go ahead. You talk about it for me.
Well, I'm just gonna, if you want to go check it out on Amazon, I would love the support. We're vying for the #1 bestseller spot right now, and it's only been out for about 10 days. So it's I Love You More. It's available on Amazon. Just type in I Love You More book on Amazon, or my name, Blake Cohen, and you'll find it on there. And I think you would find it really interesting that they're fictional stories that really tell a tale and offer perspective. So I think you would like it, and please, I'd love the support.
Awesome. Well, thank you guys both for your time.